Okay, while other people stream in, let's just go directly to the next panel, and Professor Yan Long will lead us in discussion.
Good morning, everybody. Just a very brief introduction. I'm Yan Long, Assistant Professor at International Studies of Global Health. So I want to start today's panel with a little story, sort of a historical story. So 15 years ago, in 2002, then President Bush was visiting China. For the first time, he brought up the issue of global health and urged Chinese government to change its attitude towards HIV/AIDS and take real action against this disease. So after his visit, President Bush issued a statement, quote, "President Jiang and I agreed that the United States and China could cooperate more closely to defeat HIV/AIDS," quote. This is a very important statement for those of you who do not know much about global health. Until that moment, China was very resistant to the idea of health as a global issue. It insisted that health should remain as a domestic affair left for its own national government to decide what to do. Okay, so this meeting was so important that nowadays China has become a very important competitor for global health leadership on the world stage. So this meeting was actually part of a revolution in global health governance that has occurred in the past 2 decades, resulting in the creation of radically new regimes, an unprecedented growth in funding for global health, and the growing influences of policymakers, activists, and philanthropists who viewed global health as not only a development, but also a foreign policy issue of first-order importance. The United States has influenced how health cooperation unfolds in the 21st century. It also provided leadership in global health governance revolution through expanded foreign assistance, bilateral engagement, regional initiatives, and participation in multilateral organizations. However, many deficiencies and many problems still remain in global health governance, which created a lot of not that optimal outcomes for individuals and population health. So today's panel will talk about, as we move forward, how to achieve better health outcomes and what role the United States would play in this process in the near future. Okay, now it's my great privilege to introduce you our very distinguished panelists. First, we have Dr. Mark Dybul. He's a faculty co-director of the Center for Global Health and Quality and a professor in the Department of Medicine at the Georgetown University Medicine Center. He has worked on HIV and public health for more than 25 years. And I just want to highlight 2 of his very important roles that's very close to my own research. One was his appointment as the United States Global AIDS Coordinator, leading the implementation of the President Emergency Plan for AIDS Relief, or PEPFAR, with the rank of ambassador from 2006 to 2009. Dr. Dybul then served as executive director of the Global Fund to fund AIDS, tuberculosis, and malaria. For those of you who do not know much about the Global Fund, it is the world's largest financer of anti-AIDS, TB, and malaria programs. It currently supports 10 million people on ART therapy on AIDS. Then we have our second panelist, Dr. Shawn Gibbs. He is Executive Associate Dean, Interim Associate Dean for Research, and Professor of the Indiana University School of Public Health. Not only does Dr. Gibbs has more than 100 publications, very impressive. I don't think I can ever do it.
You can, you will.
That's pretty unachievable. Okay. More important, I think is more impressively, is his research has helped to determine national policies, procedures to treat patients with Ebola, as well as other highly infectious diseases. Welcome to SGIS. Last but not least, sorry about that. As you can see, I'm pretty nervous. This is my first time as a coordinator. Is Dr. Hank Tomlinson. He's the Principal Deputy Director for the Division of Global HIV and TB Program at the U.S. Center for Disease Control and Prevention. He leads the division's 1,800 staff members working on the front line in more than 50 countries around the globe for TB and HIV treatment, care, and prevention. Welcome to Indiana. Okay, so global health problems have existed for a long time. It has haunted human beings for more than a century. However, global health sector and the profession is very young compared to many other different sectors in international development. So my first question for our panelists was, what has led to your choice of global health as a pursuit, and what is so distinctive or exciting about working in this sector?
Youngest first.
Is that okay? Is that you?
I'm 41.
It is you.
Oh, sorry. Oh. Yeah, you know, for me, I grew up in a small town in Ohio, not far from here in southwestern Ohio. So it was not something that I got exposed to much, actually, until I went to the university and really started interacting with a lot of people from around the globe. And the more I learned, you know, starting off in my undergraduate experience about their cultures and their interests and differences we had and similarities that we had, really drove me towards wanting to explore global health more as a career. You know, it's interesting. I have no formal health training. My master's is in engineering. My doctorate's in environmental science. So I approach global health from the standpoint of protecting the health providers and those that are in the situations trying to be the primary prevention and oftentimes working with those health providers to change the model. Very often we change doctors, nurses, and we train doctors, nurses, and others that it's patient first. And you know, generally when I'm working with a group, it's because there's a highly infectious outbreak. So we're teaching them that it's safety and it's their health first to respond. But oftentimes, unfortunately, we're there after the event's already occurred. So a lot of it's working with national and global infrastructure to try to prevent the outbreak from spreading beyond. One of the examples that I would give would be the great reactions within Nigeria during the Ebola outbreak. You know, they had a case and a cluster popped up, and they identified it very quickly, and they implemented their policies and procedures and prevented it from moving beyond.
Thanks. I'm 43, by the way. So,
it's the hair.
So I think that my interest and arrival in global health was also an accidental one. I'm trained as a research psychologist, so I masquerade as an epidemiologist. I've learned that the methods in the two disciplines and the research activities that are central to both are more similar than different. But so I began my career developing behavioral interventions for young men who are most at risk for HIV acquisition. And after developing, evaluating, disseminating, and providing technical assistance to health departments and community organizations around the United States for about 15 years, began engaging around behavioral science issues really with other governments. So the government of Brazil, Kenya, and decided after some time to move from CDCs to domestic division of HIV/AIDS prevention to our global work. And CDC 15 or 20 years ago developed a program where they let public health practitioners who were accomplished and capable in certain ways but doing most of their work domestically kind of dip their toe in the global health pool and try to develop the capacity of global health professionals by doing long-term assignments in overseas locations. And so I went to Kenya for a long time and found it to be really gratifying. And I think that what's most important to me and what's most attractive to me about the work in global health, which is inextricably linked to global health, global development, is the opportunity to see rapid returns on investment and the scale of change that you can affect or be a part of is extraordinary. So it's visible, the reactions to it are palpable, and personally it's very gratifying. So I'm very thankful to be able to do this kind of work, and I'm very thankful for you all who are part of creating it, sustaining it, who are the future of it. By the way, I have to say, at CDC, I get to work with a lot of really talented people. But after hearing the list of accolades for all the IU folks, I think I need to make more recruitment trips to Vienna.
So, like the others, my path was a complete accident, especially since there was no field of global health when I got started in it. That's a relatively new phrase, which is interesting for us all to remember. I was actually going to go into philosophy, theology, or poetry. I couldn't decide, and then read an article about HIV and changed my life. The president also has a philosophy background, so we share that. But I think in the context of where we are today, there is no more interesting time to be in global health and development. It is a fascinating world right now. And it's great that Dean Feinstein talked about the Marshall Plan, because I think we're in that kind of period again where we have a choice, a branch point. And in the context of two great Hoosiers and heroes of mine, Senator Lugar, really nothing would have happened in development without Senator Lugar. He was the person who pushed through PEPFAR. I think it was 2 in the morning, 3 in the morning when it first got done. He pushed PEPFAR reauthorization through. He supported the Millennium Challenge Corporation. He supported every major advance in development, not just in the last beginning 15 years, but throughout his career. So we wouldn't be sitting here were it not for Senator Lugar. We would also not be sitting here were it not for Randy Tobias, one of my mentors and friends. And I'll use another recent document that you should all read if you're interested in global health and development, called the Monterey Consensus, because that was a philosophical shift. After the Marshall Plan, it was a remarkable thing, and I'll end with that. But really, it was a paternalistic approach to development. It was white people from up here, basically, going to do things and thinking we knew everything. It wasn't partnership, it was very paternalistic. And it was about money, it wasn't about results. And the Monterey Consensus, which was pushed by the Bush administration, actually, is a short document for international documents. It broke all records. It's about 4 or 5 pages. Usually there are thousands of pages. And it had 5 main principles. 1, economic growth and development is the basis for engagement and development. But that's been known for a long time. The 4 radical, really philosophical, revolutionary pieces were country ownership, that we were going to move from paternalism to partnership, which I think we're going backwards on, but in 15 years ago, it was in 2001, that was radical. Second, accountability and results, that we were going to shift from how much money we spent to what are we going to get for the money, what's the impact. 3 was good governance, and everyone runs to corruption, which is true, but it was actually about something more important than that. It was about how do we use money to get the greatest outcomes. And that governance is more than accountability, and accountability is more than corruption. But the 4th piece was the most controversial, and that is all sectors needed to be involved. That development is not public to public, that it's about human beings, and so all parts of the communities need to involve, including the private sector. And that was almost the plank on which the entire Monterey Consensus fell apart. The Europeans were dead opposed to the inclusion of the private sector. Now everyone talks about it. But I think the center is really important, and Deborah is from the private sector as well, because a lot of innovation and really development is not going to occur if you don't involve the private sector, which is great about Randy, because when he was nominated, I have to say the entire development community was like, oh my God, this guy from Farm is coming in, what's he gonna do? This is gonna be horrible. And he wound up being an extraordinary, extraordinary leader. And in fact, without him, PEPFAR would not have succeeded. He is the reason it got up, started, and ran. It was great to work under him and learn from him. Had PEPFAR failed, we would not be sitting here today, because everyone was looking at that. Could we invest billions of dollars and get an outcome? Could we change the paradigm? Could the Monterey Consensus succeed? So had Richard Lugar and Randy Tobias not been around, none of us would be sitting here. So it's great to be sitting here to inaugurate this platform. Which brings me to where we are today and why it's so exciting. The world has never been in this kind of flux, arguably since the Marshall Plan. The socioeconomic powers in the world are rapidly changing in a way. We have had the same socioeconomic powers for hundreds of years. That is now changing. mobility of ideas, which scares people a lot, but also mobility of people. We tend to talk about refugees, but in 2015, 250 million people moved. Only 20 million of them were refugees. This is normal migratory patterns as part of the current globalized economy. It's not going anywhere. And so that mobilization is a huge thing, but the mobility of ideas also scares people. And whenever we're in these positions, as we were with the Marshall Plan, there are two ways we can go. We can look backward, inward, with fear and its constant companion, hate. Imagine if we'd taken that direction at the time the Marshall Plan was launched. Imagine if we decided to return to isolationism after a war rather than reaching out to rebuild Europe. Or we can do what we did with the Marshall Plan. We can look forward with hope, look outward, and embrace the world as it is today and advance humanity. And we have that choice, as they did at the time of the Marshall Plan. And you all, and this center bringing up the next generation of leaders, will determine that. It won't be determined in the next couple of years. We have a little more time than that. But we are at a really critical branch point. So I would say this is probably the most interesting time, even more than when PEPFAR and all that was started, to be involved in global health and development, because we are at such a unique moment in history, and it's going to be really exciting.
I like how all of you touch on the fact that we are at a critical historic moment, which can be a crisis, but it can also mean hope. I wonder, a lot of people might push back the idea and say, humanities are great, human beings are great, world is great. However, we have more issues at home. Why don't we just save all the money we spend overseas and focus on all the things in the United States? So to that, I'm wondering, in your work, in your experience, what is about the connection, or why do we need to care about the world outside of the United States in global health? Hank, do you want to give us some ideas? Since you're the one who's, flying all over the globe and, working in different countries.
Sure. I'll say that, there are a variety of ways that one can answer this question, and how you answer it, excuse me, probably depends a little bit about how you see the world or your politics. I think that what gets a lot of airtime now is talking about kind of global investments and global returns as having local benefits as well. So this sort of global is local. And that's clearly the case for a number of developmental issues and particularly for health issues. So if you take tuberculosis, for example, and you think about multi-drug resistant tuberculosis, and despite a very small number of tuberculosis infections in the United States, the arrival or development of a multi-drug resistant case is a very significant event. And we are connected to the world in ways that are ahistorical. And the countries with whom we have strong sort of community connections, with whom our residents have familial and economic and other ties, there's lots of mobility, like Mark mentioned, and sort of the movement back and forth. And I don't just mean immigration, but movement for a variety of reasons can introduce threats here at home. So in one way, I think that clearly articulating the benefits of investments in global health, because the interconnectedness allows for movement of pathogens and microbes in ways that it never has before, makes for investments at home. So to people that are not so interested in global issues, or who think that the resources, like you mentioned, might be better spent here, I think there are compelling ways to tell stories that can actually capture their attention and interest. I also think that, so I'll say two more things. The first is during kind of the ebbs and flows of interest in a variety of things, like there are positive consequences to what seem like very difficult times. And so as global activities and support for global activities might become more challenging or resources become reduced, it forces you to sharpen your tools, to become more precise, and to become more careful about how you communicate your impact and value. And so just as some in the community might feel like there is a forced taking of one or two or more steps back, I think that probably prepares people who are doing the work to move forward. And then I think the last thing is there is you know, in social science, something that shows up in a number of contexts called the contact hypothesis. And often you kind of don't understand a thing, or you might fear a thing because you haven't ever actually encountered that thing. And I can tell you, you know, and so I probably come at this more as a practitioner who's engaged to some extent in policy than folks who have kind of done and seen it all, or folks that come from an academic perspective that has real translational value. And as a practitioner, what I can say is that I've been with folks who don't sort of, who don't advance the value of global investment and global activity. And when you are visiting an antenatal clinic in Western Kenya or in Nigeria, and you see a pregnant mother who's living with HIV, who is not going to pass on HIV to her child because she's on antiretroviral therapy, and the prophylactic effects mean that that is almost certain to not happen. Or, most importantly, or what I've seen maybe be most impactful, is a 13-year-old young girl stands up and says, both of my parents died of HIV, and I'm alive today because the United States government and your people have provided medicines for me for my whole life. Thank you. And so whether it's something big and related to policy, whether they're academic perspectives, or whether it's down close and personal, I think there are different ways that you could think about this contraction that we may be experiencing in pretty real ways and the consequences of it.
So maybe just to build on that, I mean, I do think all those points are valid, and I actually completely agree with what Hank said. When you start talking about movement of microbes, you can get people really anxious. So some people's instinct is shut down your borders. And we actually have members of Congress who are saying, just shut the borders down and we'll be fine, which is not a good reaction. So how we message that, we have to be somewhat careful about. The former Secretary of Health and Human Services, his initial reaction was shut down the borders. His wife's reaction was shut down the borders. So we have to be careful around that somewhat. But really, just look at history. I mean, there's not a single example in history of an isolationist approach succeeding. China's a great example. The country collapsed, the dynasties collapsed because they shut down their borders and were internal. There is not a single example in history I'm aware of that tells you that this will succeed for the long term. So it's nice to have a little historical perspective periodically. But I think, you know, there is the humanitarian piece which we should not lose. What represents the American people? What is the best of the American people? When do our values come forward in the best way? And I have to say, and Senator Lugar can certainly correct me, but that has a lot of resonance with policymakers and leaders. Most policymakers want to be part of something bigger than themselves. They want to do something important. And we should never lose that piece. And I think it's a really important piece. But we also have Adam Smith's notion of enlightened self-interest. And this is not, in the globalized world today, we will not succeed. If you want to put America first, we cannot close our borders. We will collapse. And that's true on a peace and security basis, and it's also true on an economic basis. So from a peace and security basis, Randy and I were talking about this last night. I mean, Secretary Mattis is quite clear. If you don't invest in development, I have to buy more bullets. That's literally what he says. Secretary Rumsfeld, for all his issues, you know, called Randy in when he became head of foreign assistance and said, I need you on development because we're not going to succeed in our peace and security agenda without that. And that's why Condi Rice first put development as part of the 3 Ds, defense, diplomacy, and development, as part of the national security strategy which the Obama administration carried forward. So there's no question on the peace and security angle, we need development. Now you can argue about global health's role in that, but then you come to the economies. When Randy was the head of PEPFAR, you know, coming from the private sector, we initiated many public-private partnerships. It really was a new and exciting era in public-private partnerships. And one of them, and I'm just going to give you an anecdote that explains this in a crystal clear way, was with Walmart. And I went to meet with the CEO of Walmart at the time, and I asked him, why on earth does Walmart want to work with the Global Fund? And or with PEPFAR at the time. And he said, look, you can't see it, but I source from Africa a lot. It's not my main sources, but it's my sub-sourcing. So I need healthy people. I can't have everyone dying if I'm going to get production out of them. But I'm also projecting for the next 15 to 20 years, where's my growth? And I can tell you that if Africa doesn't grow, I don't have anyone to buy my stuff. You know, there will be no jobs for Walmart in the United States if Africa's not growing. So development is directly in our financial interest. Absolutely directly in our financial interest. And that's hugely important when you're having conversations. It doesn't look like it in the short term, But in the long term, that is how we're going to have economic growth. And the last piece of that relates to what we talked about before, which is refugees. We actually raised a lot of money in the last Global Fund replenishment off this issue. If you look at the world today and those migratory patterns and refugees, the population of Africa is projected to double, even with birth control, even with declining fertility rates, to double by 2030 to 2050. And so what we told the policymakers are, if you think you have a refugee problem today, what do you think the world's going to look like if you double the size of that population without health and education, which are the backbones of economic growth and development? What do you think the world's going to look like? It is just so crystal clear what the pathway is. The question is, can we get over the emotional response of isolationism and actually be rational and think about what the world can and should look like and how we put those issues forward in a way that deals with the real issues of jobs for now, security for now, and emotional comfort when there's so much change. And that I don't think we pay enough attention to that. The emotional response to change for human beings is a natural fear. And if we don't recognize that and deal with that, we will never win these arguments. But we have to deal with that issue. But the rational piece of it will overcome if we work on it.
Oh, well, just to follow up, you know, I'm the infectious disease guy up here, and you guys took my infectious disease examples. So I'll switch off of that a little bit.
I used to be infectious diseases before I became a bureaucrat.
There you go, there you go. So, you know, just talk about the free exchange of ideas. For the past few years, I've run a institutional Fulbright program for Libya and Egypt, where we've brought scholars over here. We worked heavily with them, trained them in public health, and then they go back and become force multipliers within their their countries to achieve a lot of what we've been talking about here. But, you know, in engaging in the global environment, we also get a lot of value and a lot of return. We tend to be over-reliant on technology. I think all of us would agree with that, as every single person here has a smartphone in their pocket, and so do I. So for maternal child health, one of the things that's come along recently or within the past decade actually came out of a country without a great deal of access to technology, and that's kangaroo mother care. If you're not familiar with kangaroo mother care, it's essentially the revolutionary idea that instead of taking a premature infant and sticking it into an incubator, that you engage it in skin-to-skin contact with the mother. You know, it's not something that we would have gone to first in the United States or Europe or something, but because people had to be innovative and people didn't have access to electricity and so on, it's something that they've done. And the research shows that it works, and it works extremely well. And shocker, it's cost-effective, and it's a good return for the mother. It's a good return for the child. And now, you know, I know a lot of the audience is, you know, too young to have children right now, but or hopefully. And then we go out and we see now here in, you know, Europe and the United States, you know, a lot of this is now come back here. And, you know, a premature child here in the United States, now there are volunteers who will go into the neonatal intensive care ward and will have skin-to-skin. That came out of our engagement and our development. So,
I think that's I think what we're all talking about is really how to get the best return for our investment, and there's tremendous potential. So I'm wondering, Mark and Henk, from your perspective, what kind of research or method that the scholarly or academic community could contribute in order to ground global health investment in a much better way?
So having been an academic and being back in academics, I think it's a challenging issue because it's really, we call it implementation science. I don't particularly like that word, or phrase, but you know, how to get the best return on investment is an important action. I do think we tend to focus in the academic world too much that's academic and not on what is relevant for policymakers. And I actually do see this quite a bit. We churn out lots of papers. No one ever reads them, really. And the data aren't calibrated for policymakers. And I've been talking with some people in development you know, someone who did some of this work in Latin America, I won't tell you the country, was meeting with the minister, and they went forward with all the data on what they could do to improve their program, and the minister just said, oh, thank you, that's really helpful, I appreciate it. And he said, no, 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 if you don't change your policy, we fail. And he was like, well, I'm a politician. Tell me something political that's going to make me change my mind. You know, this is just data. So, you know, we need to start formulating data in a way that is relevant for policymakers. And that things we do not do that I think we need to do more of is project out opportunity costs. So if I don't invest in something today, what do I lose? And what will I have to pay for the long term? And then you can start calculating, can I afford this? Or external financing. How does external financing fit into a long-term financing future for me if I'm investing in different ways? This we do terribly. You know, the reality is in 15 to 20 years, there will be maybe 24 countries that are getting money at the levels that we have today. I mean, this era is over, really, because of economic growth in those countries. And so how do we, for the future, invest, for example, in health insurance? I mean, how would you actually invest in health insurance? If you're in Southern Africa, you cannot develop a risk pool today because risk pools are basically based on young people. Well, if 20% of your young people have HIV, you've just blown your risk pool because they're going to cost more than the old people. And so how would you, for the short term, invest, maybe using external finances, to protect that risk pool from HIV so it can grow to a rate where it will be able to manage? In India, you'd look at TB. So how we link disciplines like economics and business and management and policy with basic research into how do I deliver antiretroviral therapy better. Those linkages, and I think this center and link maybe with your other center would actually be a great way to start addressing some of those issues that policymakers would then respond to.
So my response is probably less of a research question and more about methods and tools, and it moves from the policy research discussion to maybe one that's closer connected to practice. And that is to say that, well, there are two points to make. The first is, I think demonstrations of impact and value are also likely to substantiate the need for future investment. And so at CDC, we've recently concluded, and we're in the middle of conducting several more population HIV impact assessments, or what we call FIAs. And these, we benefit in HIV from having the ability to measure certain biomarkers that, whether it's HIV infection, progress of the disease, deterioration of the immune system, or whether the virus and the viral load in your body is suppressed, which means you're more likely to be healthy and not pass the virus on to others. We have been able to look in the sub-Saharan country, and so we're investing in 14 of these right now, and it's likely to grow in the future. And so we've concluded 6 and have been able to demonstrate that these are national household-level surveys where tens of thousands of persons per country are surveilled and or who participate in the surveys. And we've been able to see that there have been incredible gains in kind of all parts of the HIV clinical cascade that are necessary, finding out that you're HIV positive, getting connected to medical care, staying in medical care, getting on drugs, taking your drugs, and ultimately suppressing the virus. And so now we have a body of evidence that suggests this is doable and it's working. And not only have kind of communities and countries and economies been stabilized, back 15 years ago, there were places where 1/4 to 1/3, or actually more, of working-aged adults were HIV infected, and that was incredibly destabilizing. So we're able to take these kinds of results, say that they translate into sort of measurable and meaningful gains. It means the programs have been working, but it also, because of the special emphasis on catching large groups of different populations and different geographies, you can identify where there's still need. And so it's a model from HIV that's not replicable across all other health conditions or diseases, but it's something that I think will help substantiate the need for investment in global health. And the second is less a method than a tool, and that is to say, we also have moved toward harnessing the power of data. And I know that that's something that people talk a lot about now. It's on magazine covers, and it's an exciting topic for a lot of people. But what that means in global development or global health is that we know what's happening at the most granular level possible as frequently as is practicable. And so while PEPFAR has always been rooted in having very clear goals, looking for measurable results, reporting those, and using those to inform future programming, now we have invested in the health systems and in the human capital so that we can, in many places, tell you what is happening in a particular HIV testing site in a rural community in a sub-Saharan African country this week. And then that can lead us to ask questions like, what is the person that's leading the program, or what is the counselor, who's providing the HIV testing service at the lowest level possible doing that's right or wrong? And so you can look at the facility level and see how that's better or different or worse than others. Then you can group facilities and look at communities and see how those are like or unlike others. Then you can look at countries and see how those are functioning, and it sort of helps us with our programming. Now, this is something that has been purposeful and effortful, and there have been investments from a variety of places and donors, and we couldn't have gotten there without that. But it's taken a long time to get up to this point, and if we can accelerate the utilization of data, which means it's meaningful and accurate collection, synthesis, comprehension, and then ultimately utilization, we can do more with the resources that we do have, or with future resources if they decline. And so the tools that are available, whether it's for all things data, their collection, the analytical techniques that are used to answer questions, machine learning opportunities that are burgeoning, those are things that I think are interesting sort of points of connection for global health and development to other parts of science, engineering, and technology that we can use to accelerate sort of progress.
So I think, Hank, you represent the great US tradition, which is a very disease-focused model. And we have achieved great success in this area. And I think Mark was talking about maybe now we are trying to move, I think both PEPFAR and Global Fund is trying to move from disease-focused to a more comprehensive, systematic efforts to tackle global health. So I'm wondering, Shawn, from your perspective, what do you see as the future of disease-focused model, and is this going to continue to dominate, or what else can we do?
I think unfortunately for the short term, it probably will continue to dominate. There are positives and negatives to this. It gives us a goal, it gives us a focus on a disease, but oftentimes the negatives, it can make us a little more myopic. I just wrote an opinion piece with a group of my collaborators where we're particularly looking at the U.S. response to the recent Ebola virus outbreak. And one of the things that we're arguing is because a lot of the funding associated with it is tied to specific diagnosis of the Ebola virus disease, that it is actually detrimental to being utilized for loss of fever or for other diseases that are very similar, because the funding mechanisms for various countries as well as for our own country is so heavily tied to that specific disease. So we would like to see, kind of a using this as a jumping off point so that we can strengthen overall global and national infrastructure. But we've also had a great deal of success in that model.
Do you two want to respond to that?
Well, I would challenge the notion that PEPFAR is going in the direction of broader. I think it's getting narrower again. It was going broad, but it's getting quite narrow again. Frighteningly so, in my opinion, anyway. I know Hank's trying to do differently, but he doesn't get to make the decisions all the time. So, the reality is, in 2000, 2002, no one had any confidence you could spend billions of dollars and succeed. There was no example of it. I mean, all we had was a bunch of pilot projects that were controlled, by people from other countries. And so there was no confidence, really, that you could invest a lot. So we had to show success. The part that annoys me a little in all these conversations is the notion that, when PEPFAR started and we put goals forward for prevention, care, and treatment, we were roundly criticized by the development community for setting goals. It was too complicated. You can't put numbers on it. We just have to put money in and things will happen. That you don't go from no economic growth to economic growth. You don't go from no supply chain to a full supply chain. You don't go from no health care to universal health coverage. There are steps along the way. So we have to get, and I think the academic community could help enormously here, what are those intermediary benchmarks? How do we rationally look at changes over time And it's not going to say you're there, but it will tell you if you're on the right path, because if you're not reaching certain benchmarks, you're not going to get to the end. Antiretroviral therapy is a great example. The goal was not life saved, because we couldn't say that in 5 years. All we could say is number of people on treatment, but if people weren't on treatment, you weren't going to get to life saved. So what's the equivalent in other areas? Without those benchmarks, it's very difficult to convince people to invest in programs that are broader than a specific outcome. And if we don't get better at figuring out what those are, it's really hard to get out of those individual programs. And it's really complicated for the countries that we're putting all this money into. Incidentally, most countries now are putting more than external, at least in upper low income and certainly in middle income countries, where external financing can be 6, 7, 8% of a program versus 80, 90% in low income. So as that starts happening, if we're pushing all our money through these individual spigots, what do you think is going to happen when they're putting their own money in? Well, they are doing the same thing. So if we don't do better on our own about what are the intermediary benchmarkers. For example, what Randy tried to do, and it's really complicated in the US government, what's a development plan for a country? Not what's an HIV plan or an economic growth plan. What is a development plan for a country? And what do the benchmarks look like, both within a sector but more broadly? This is doable. I have no doubt it's doable. We have to shift from this is my program, this is my money, this is what I'm going to do, to this is where the country is. And for our own interest, we need development in that country. We don't necessarily just need an HIV outcome or a malaria outcome. We need development. So what does that look like? And universal health coverage, I think, gives us an opening for that. But really, we need to do much better at understanding what are the accountable benchmarks within a broader approach that can be used so that you can advance and show progress to reach money. Otherwise, it's going to be very difficult to get out of these.
I think the measurement issue is central to the conversation. Mark's articulated that nicely. I also think that there, to some extent, is an inescapable reality that there are bureaucracies in place that fund at the disease level, and that those are likely to continue and be replicated as countries move from low income to middle income. I also think that there's an opportunity, an unrecognized opportunity, to take the maximum possible advantage of the collateral benefits of disease-focused activities. And so I can give an example. And this has been intentional and purposeful in a lot of programs and places over time, but it has not been optimized so that it is such in all cases. In Nigeria, I was the CDC country director from 2014 to the beginning of 2017, and so there are 4 programs in country: HIV and tuberculosis, global immunization, which is mainly focused on polio, parasitic diseases and malaria, and global health security or global health protection. So 3 of those are kind of disease or diseases-specific activities, and then global health security is cross-cutting and focused on systems improvement. When the previously mentioned importation of Ebola happened in Lagos, in 2014, there was, Lagos is a city of 20 million. It's a city filled with people who travel not just all throughout the continent, but to the United States and to Europe in massive numbers. Depending on which demographer you talk to on any given day of the week, there's somewhere between 140 and 200 million Nigerians, and they move a lot. And so that was able to be contained in a way that was not possible in the 3 heavily affected countries in West Africa, and it was largely a result of the investments that donors, including the US government and PEPFAR, and the Global Immunization Program had made for polio and HIV. So we're able to take a workforce that HIV resources had trained, take the emergency or incident management structure and how to respond to an emergency that polio had developed in the north of the country, and then take the laboratory capacity that both had developed, move that all down to Lagos, and work together to do the contact tracing, the laboratory work, so that from detection to response. Didn't work perfectly, but it worked sufficiently to contain with a limited number of transmissions. So that is to say, there are disease-specific activities that build larger system equities, and how those come together can still be can be improved. And so I think a lot of times the people that work on these things end up working beside each other, but not talking to each other. So if you think that information about your laboratory activities to improve diagnostic capacity for X, Y, or Z happens because you stand at the water cooler together, it doesn't. And so on the ground, they're just practical realities that sort of require connection of these programs. And we at CDC are working for that and toward that end in our country offices. But I think that sort of the coalescing around that among the multiple sort of donors and actors in the international community allows, even in a disease-specific model, there to be significant, outside benefits.
So in this whole process, given all the opportunities and the challenges, what do you see as the United States' role in this whole process? And who are our competitors, or who want to become the next leader?
Well, I mean, if you look at where we are today, you know, we are still operating under what all of you, I'm sure, know is called ODA, or Official Development Assistance. I despise the word assistance, recipient, donor. So do the countries, by the way. You know, this actually is about partnership. It's not about you know, donor, recipient. We use the terms, I use them, assistance, aid. They really hate those terms. They put up with them, but they hate them because it puts them in a subservient position, not a partnership position. And the reason I say that is because, you know, if you look at the G20 and who the powers are, like emerging, like China, India, China more so, you know, they were in this recipient position. Mexico, they don't like it very much. The Brazilians, they don't like that model. So when they meet, they don't talk about donors and recipients and replicating a model that treated them like children. They don't like that model. And so if we don't start changing pretty rapidly, they're going to overtake us. And the model is shifting. I mean, the donor base, I mean, we talked about, I can't remember, I think it was Dean Feinstein, about how the money has increased, but it's really stabilized. If you take the Gates Foundation and the UK out of it, it's actually declined significantly. Now, if you look at the overall ODAC numbers, or the ODA numbers, it looks the same. But countries, I mean, so the UK used to be around 80% of their budget that went to their international organization, DFID. Now it's 70%. Because they're putting it into their own health system. And you can count that as development assistance. The Nordic countries reduced their development by 40 to 75% during the refugee crisis, but they still counted as development because they were taking care of refugees in their country. And so that model is so antiquated, and the notion of donors and recipients is so antiquated and so anathema to the emerging powers that, you know, the G20 is thinking about things in a fundamentally different way. And they're also looking at how they can provide technical support, not assistance, technical support in a different way and partner, which they see as a great diplomatic opportunity, which I've always thought CDC has a greater strength than some of our other development agencies from a health perspective on this, that they see that partnership for the long term, technical partnership and association, and that leads to private sector coming together, that leads to investment, and you know, it's a fascinating new world. And China actually has, you know, the thing about China is they can change really quickly. They were taking a very paternalistic, colonialistic approach to development when they started. They were just going in and buying up concessions, but they listened, and the Africans told them they didn't like it. And it took them about 10 years, but now they're actually shifting to a different model, and they're trying to set up this bank. They're not happy with the current institutions. The Global Fund's a great one. We have no seat at our table for these emerging economies in our board, and our board won't let them in. How can you have them engage with you if you don't let them on your governance structures? I mean, we are so antiquated. We still have the mentality, even though we're trying to shift, of the pre-Monterey consensus in our structures and our bureaucracies, and the world's going to just come around and change without it. So this is why I think it's such a fascinating time in development. Everything is changing. Really, for the first time in hundreds of years, everything is changing. And our systems are not built to respond in this rapid way. And so how it's going to happen, I don't know. The G20 is still trying to figure it out. They put health on their agenda for the first time because of tuberculosis and because India insisted. But how they move is going to be really interesting. They don't know. So if you guys have ideas, put them forward, because they're trying to figure it out. But I think it's going to be really interesting. I think the question is right, because the model that we've been operating under is not going to exist. By the time many of you are in the positions we're in, this model is gone. So what's it going to look like? What do we replace it with? Which is why I think innovation and how you bring all these different sectors together and how we look at the world in a different way is fundamental, and it's why it's such an exciting time.
You know, when it comes to global health, you know, I agree with everything you said. When we're talking about competition within the global health marketplace, you know, I'm looking at it more as potential collaborators and who can work with. You know, I was surprised. We tend to see that more on the local levels than more on the global levels. A number of years ago, I was in northern Iraq working on actually a TB thing. And I was surprised that they were actually having their laboratory testing done in Iran, which, given the history of that area, really surprised me, and I asked a number of questions just trying to clarify. So the national players, you know, the global players, the nations that are going to be involved there, you know, he's done an excellent job of outlining and really drilling down to. I'd focus more, at least in my area, you know, I tend to be more operational in the local level. So seeing what we can do to broaden a lot of that local coordination and collaboration that we're starting to see burgeon up.
So this question is actually for my students or other students at SGIS. So for the young generation to really take advantage of this tremendous opportunity, what they can do in a very concrete way? What kind of talents are you looking for? What kinds of obstacles they might need to overcome in order to get in this sector?
I'll talk about a weakness I have, and that I think is one of the things that I think this group is accomplishing. I have tried for about a decade now, because a lot of the work I do is in North Africa and the Middle East, to learn Arabic. I have no gift for it whatsoever. I lived in Egypt for a year. I've collaborated and published with groups out of Libya. I cannot master it. My sister speaks 3 languages, and it annoys me to no end that I cannot develop it. So, you know, at least in my interactions, I feel a bit of a disconnect to the populations I'm working with, and trying, when I can't communicate with them at a basic level in their own language. They drastically appreciate it when I try, but at some point they just go, no, let's go to English. I think they appreciate the effort. That is a skill set that I do not have. That is a skill set that I regret not trying to pick up while I was an undergraduate. So, you know, of the broader ones, that's what I'd put out there, you know, from my perspective.
Hank, what do you think from CDC's perspective?
Well, when we can hire again, come work at CDC. But no, in all seriousness, and we can hire medical officers and epidemiologists. So if any of you are those, usajobs.gov. Yeah. But that's only semi-serious. It's true. Yeah, our Epidemic Intelligence Service program is quite strong and has trained disease detectives that sort of are part of the worldwide workforce to, you know, immediately reach out and go toward a problem, not away from it. I would say, though, in all seriousness, we benefit, and this was alluded to kind of at the beginning of the discussion several questions ago, from having a vibrant workforce and community of doers, not just thinkers. So informed academicians who are focused on translational work, who are focused on implementation, who are focused not on just writing a journal article that's something that goes on your CV and a bookshelf, but making sure that there are practical applications of your work is of extraordinary benefit to those of us who are in the business of doing. And so I also think that there are important things, and this might be different for some of global public health than other parts of global development, but the rate at which change is happening now is exceedingly fast. And there used to, let's say, be an opportunity for a 5-year research project to investigate a certain phenomenon or answer a certain question. After that, there'd be, you know, a year to write up your results. And after that, there might be a literature review or a research synthesis. And after that, there might be somebody that, if they used your data and the, you know, the knowledge that you generated, would take that information and then make decisions, apply resources, redirect programs, et cetera. Now, at least in PEPFAR, we are looking at iterating with knowledge learned from ongoing collection of programmatic information, routine surveillance activities, and then some special projects that inform core interventions. But the life cycle for that is not 10 years or 12 years. Now we're talking maximally probably 2 to 3 years for most things. There's some things that are different and will take longer, but I would say, so even sort of the generation of knowledge creation has a different timeline than it has for most who have been involved in it from an academic perch. So I would say get into it, focus on translation and implementation, get out there, get your feet on the ground, make sure that you are connected to the non-paternalistic aspects of our work, and then don't be dismayed by the challenges that you face. There will be incredible learning opportunities associated with them.
He made a very good point that I'd like to jump in on is, you alluded earlier about my number of publications. The first 50, I did exactly the model you're talking about, where, went out to my peers and they're like, that's great, and 5 of us read it. For the last 50, what we've been doing is, as we're writing it up, I have the students, because generally I'm working with a student, write up a white paper, and we're partnered with a number of professional and government organizations. So we write up just a 1-2 page max white paper in ways that they can utilize and experience and understand it and say, this is why this is important to you. And we push that out there simultaneously, because as much as we in academics do like our papers, we're the only ones who read them. I mean, that and my mom, so who doesn't understand it.
Yeah, she just read it, yeah.
Yeah, she's just reading it to tell me she did.
But you can do that because you have tenure and you did the first 50. Right?
Yes, he's not wrong.
So
he's not wrong.
That actually requires the president and the dean to start changing what the requirements are for the future. What does an academic in today's world look like, and what are therefore the requirements for succeeding, so that you don't have to get tenure in order to have the luxury to do those things. So I would say 2 things from a high level. I mean, this is great because Hank and you guys are going, and I just think up here now because I'm too far removed from the real world. So the 2 I would say are always think globally. That the world is globalized and that solutions are going to be global. There will be no local solutions for the future. So that mindset is not easy. I struggle with it, and I just engage globally all the time. But if we're always thinking globally and thinking solutions are global, we'll look for things that we'll miss otherwise. And the second is to be very open to other disciplines and the validity and importance of other disciplines, and look for opportunities to bring those disciplines to bear. Because we do tend to think in our disciplines and our systems kind of whether we're implementing PEPFAR or academics, we are forced kind of into a discipline, and we're comfortable there. So we're in our own comfort zone. It's a little like being uncomfortable with migrants. We're comfortable in our zones, and we get very uncomfortable. And the natural reaction in a human being is the same. Oh, that's not a valid approach. Social sciences don't count. Only basic science. We do that. And so if we think globally and think interdisciplinary, then I think we can probably solve anything. And that's probably the profile we're looking for. I do get very anxious when people say, what talents do you need? Because then students can say, oh, I need to go study that even though I don't like it. If you study something you don't like, you're probably going to be pretty unhappy, and you're not going to be very good at it. So looking for what you love makes a pretty big difference in your own personal happiness, but also in whether or not you're good at it. And if you're good at something, you can usually find a job. But the other thing is Hank's point. Things are changing rapidly. What we say we need today could be radically different in 3, 4, 5 years, certainly 6, 7 years. Now, we can project out that we need people who understand finance, that we need people who understand the shifting from a grant-based system to a fundamentally different approach in development, how that works cross-sectorally, how the private sector comes into play, how small official development assistance is as an overall piece of the development puzzle. Those things we can but within that, there are many approaches to it, but if we think global and think interdisciplinary, we'll be able to solve it. And in a way, your question was advice. What advice would you give about what fields to pursue? I always joke around that if you give advice, if someone's giving you advice, don't listen to them, because they're telling you what they would do if they were you. And they're not you. I mean, you're the only one who can weigh what is right for you. And we need people to do everything. It's how those pieces fit together. We need people to do every piece of development, of every human response. We need people who do different things. We just have to pull it together. The only advice I ever give is, if you are doing in 10 years what you want to do today, you probably messed up. Because you were so focused on one thing, and you kept your head down and didn't see all the things that were flying at you and the possibilities and opportunities. And the fact that each of us responded by saying, where we are today is a total accident, I think is a pretty good example of that. So these conversations are important. You have to plan your life. You can't just go off and do, oh, I'm going to change every week. But if you do what you love, if you think globally, if you're thinking cross-disciplinary and how you can bring people together and think in different ways and reach across the globe and reach across a discipline, that's where we're headed. But within that, I think you all are going to decide in some way.
I want to riff on, in addition to sort of thinking, you know, interdisciplinarily and thinking globally, I would also encourage you, like, although we benefit from having keen, you know, folks with keen observational skills and who are capable of shrewd analysis, please be solution-oriented. If you are not generative and can't, like, we need folks that are equally strong on that side of the house as well. Like, for all of the, you know, in the academy, you can achieve a lot of
success.
That's the word. Yeah. You can make it pretty far with sort of descriptive, analytical work. And I think that we also need to be in the business of trying to solve problems. And it's okay to try to solve the problem and to fail. It's not okay to not try to solve the problem. And we need all of the sort of new ideas that you all can bring to those conversations and opportunities.
Yeah. Well, and kind of going off what you were saying earlier with all the students in the audience, you know, when I was an undergrad and sitting on yours, I was not thinking of where, I had no plan to get where I am today. You know, my plan was, you know, to go, I got a job with US EPA, I worked there for a number of years, an opportunity opened up, another opportunity opened up, and at each time you just got to reevaluate where you are and where you want to go, and is this a more interesting path? So I mean, you know, just I really taking a look when those doors open and figuring out if you're willing and to walk through them and if they make you happier.
Yeah, with that, I'm sure our audience has a lot of questions for our panelists. Now I'm just going to open the floor for questions.
Can you hear me?
Mm-hmm. Yeah.
Yeah, I'm Kevin McNamara. I'm an economist, development economist from Purdue University. And I appreciate all of your comments. I work primarily in the agriculture sector, but especially Dr. Dybul talked about the link of public health to economic development. And one of the questions I have that I don't think you touched on very much is what American institutions or developed institutions in developed countries can do to help build human capital and institutional capacity in developing countries so they can take the knowledge gained in developing countries and apply it in an appropriate context in the countries they work in. And I appreciate all of your comments.
You've got the most experience with this.
So I think it's actually a great question. And agriculture, you know, if we don't get agriculture right in the countries, there's no hope of any growth and development. So I think your question is, and I know you didn't mean it this way, but I think we need to look at it from both ways, because the notion that we have all the innovation and the answers and we're going to provide them to them and they are going to listen and learn from us was true, I think, 15 years ago in a lot of ways, and is still true in some sectors, but I don't think it is anymore. And I'll give you a very concrete example, you know, and this is why innovation is so important. And this is what I'm working on now. The amount of innovation that occurs at the community level is extraordinary. And we know this from the private sector. Communities of practice, human-centered design, you know, drives a lot of innovation and improvement. We've not brought those things to bear, but there's enormous innovation that happens at the community level, where they try to solve an agricultural problem or a health problem. How do I get antiretrovirals to someone? How do I get someone to come in and take their TB drugs? How do I find that case of Ebola that someone's hiding? You know, these are innovations that occur at the community level, and we don't do enough to catalyze and capture those. But there's much innovation happening in these communities that can actually be very relevant for us. Not the technological advances, which we do need to share, but at the community level of how you take a technology and implement it. And as a very good example, there's a guy, Mike Sag, from the University of Alabama, who was involved in the very early PEPFAR programs in Zambia, because they were on the ground, you know, doing what we used to do. This is our program. We're sending all our doctors over. But when PEPFAR came in and they had a lot more money, they couldn't do that anymore, so they expanded rapidly. And over the course of really 2 years, he realized that the lessons and the innovations that the Africans were doing to get services out to people who were difficult to reach had enormous relevance for him back in Alabama. And so he created a program called ZAMBAM, for Zambia, Alabama, for cross-learning. So the amount we can learn from them is actually extraordinary as well. And so I think academic institutions have an absolutely critical role in helping that two-way knowledge sharing. and helping stimulate innovation. But we can't do it in the usual model. It has to be in a different model and a different approach. Now, getting money to do that isn't always easy. But I do think that the countries that are emerging, this is what they're interested in. This is they're most in information sharing. If you go to India, if you go and tell an Indian government official what to do, they will kick you out of the room, as they should. If you go and say, we have information that we want to share and learn from you on, they want to sit down. They are ravenous for information. They are ravenous to learn what's out there, as long as it's in a partnership and shared agreement. Facilitating those things, I think, are what development institutions should be doing. We don't do enough of it. But the appetite is there, especially among the new powers in development. And so, again, I think this is a key role for universities. It's not a traditional role we've played. We've actually done it more one-sided. I think the more we can bring in the two-sided, and agriculture is a great example, and so the more we can draw those things together, and we can begin with social media and online stuff too. We don't have to always do it in person anymore either. So there's real opportunity there, and I hope you and everyone in this room tries to pursue that, because that is probably the future of development, how we share and learn from each other, and we will learn a great deal as well.
I'm sort of cornered here. If it's okay, I'll remain seated to my laptop. Following up on the comment, I think, of our colleague from Purdue, one of the things that the United States, for example, needs in its efforts to contribute to development in less developed countries is strong counterparts for the ownership that they provide, for their ability to devise local solutions locally and identify where the partnership, support, assistance, whatever term we like, from our side is useful. The capacity to do that largely comes out of good professional education in local universities in those countries, as well as some opportunities to visit institutions like IU in the developed world. The US has a great legacy of helping develop universities and professional education in developing countries. President McRobbie mentioned some of those cases in Thailand and elsewhere. But the United States has been quite inconsistent in that. It's been individual officers' efforts, really, that have made that happen in different countries. And just recently, Administrator Shah eliminated the Higher Education for Development program that had been going on for a generation in the American Council on Education, and eliminated it specifically to provide more funds for US-based researchers to come up with solutions to development problems, which to my mind seems to be, frankly, a step backward. So I would like to see, just throwing out the idea of university development and professional education development in the developing countries as a mode of assistance for US and other development assistance-oriented countries, what the panel might think about that.
Well, for a number of years, I've been involved in the IIE institutional Fulbright programs. So that's a model where, instead of just the one-offs that the Fulbrights are, where they bring large cohorts over and they work with individual universities. This year, we had the public health one for Egypt. Previously, there's been Libya. They brought in a number of very specific disciplines. These programs have tended to be, well, this is a newer program that only came out essentially in 2012, 2013. And has been moving since then, but mostly for those countries that the State Department had felt had emerged from the Arab Spring. So it's not something that's been widely utilized. I think that would have potential to go broader. One of the flaws that I see with that program is we bring people over here, they're with us for a number of months, we work with them, we train them, but there's not necessarily a defined mechanism for the return of information back except for through them, so the continued collaboration. My groups have done a fairly good job continuing with a number of the scholars we've been working with at the University of Tripoli. I just lectured last week at the American University of Cairo and the University of Cairo through Skype technologies. So, as they're looking into programs like that, I think they need to potentially look at more on the back end and the sustained relationship between the organizations. I mean, technically, I fulfill the obligation through the training here, but that's just the first step. You have to have that continued involvement and that continued back and forth.
So I think PEPFAR over time has invested substantially in university initiatives and education programs in sub-Saharan Africa, both for medical education, nursing education, and for a variety of kinds of pre-service and in-service training for professional and non-professional practitioners. I think that results in some cases have been positive, but not uniformly so. The things that come to mind for me are actually the kinds of problems that we see on a regular basis is someone might benefit from a program like that, and as soon as their work in it is completed, they move to a place where compensation is higher. And so there are questions about sort of demographic issues in the country, economic conditions that sort of, and there are ways to deal with that and mitigate the risk of it happening, but that's one of the things that's not uncommon, as is the sort of concern that the human capital that's developed through university or related education initiatives is additive to what would have happened on its own, and it doesn't create sort of a movement among professional cadres that creates vacuums at just a slightly lower level. Because if that's what happens, and you have a cascading set of problems where you still experience significant deficiencies in kind of health service delivery systems and workforce.
I'll just stand. So I'm a student of Professor Yan Long's Global and International Health class, and I noticed a big theme in the panel was that external aid was seen as inefficient. But in many ways, the US is stuck offering external aid to countries that are reliant of the support and resources that we offer. My question was, how do we shift from external aid to developmental aid, and what would be the steps towards developmental and economic success for these countries?
You have a good professor, or you're really smart, or both. I mean, that's a huge question. And I do, I think that's been a large part of the conversation, which began with the Monterey Consensus. I mean, we did start thinking differently, but our institutions haven't caught up with what that looks like. The change that's going to drive this is the over time decline in external financing. So there is no question of the arc. The question is the timeline of their arc, but there's no question external finance is going to go down. And there's no question that the relationship between the countries is radically changed. We might not know that, but the relationship is radically changed. So then how do you start shifting from these massive programs to more country ownership? And at the beginning, we had to do most things with external partners. We don't need to anymore, but we still fund most of the external partners. The relationship needs to shift. Who's in charge and who's not. And if you look at the government, if you look at the countries that have succeeded in development, it's where the governments have taken ownership, where the countries have taken ownership, and basically told the development partners if they don't follow the national plan. There's a minister of health in Rwanda who would sit down and say, this is our national plan. You can follow it, or the airport's down the road. And there's a reason they succeeded. Ethiopia the same, and others. So the power dynamic within the countries is shifting. The question is, will we respond to that? And then what's our role in financing for the future? If we know that over time, we will be down to large programs in a half dozen, or several dozen countries, and those will basically be fragile states. It's not necessarily the states today that are fragile. You know, countries that do really well fall back. Some countries that are doing really poorly today could do really well, but there's likely to be a couple of dozen countries that are in a fragile state for a while, and then we'll have larger programs in. So what is our role, not only as a government, but as a country and as people, academic institutions, the private sector, how do we put all that together? That's what Randy actually tried to do with the development assistance. We're hoping Mark Green, who's trying really hard to think that way, who's the current USAID administrator, is driving for. We're trying to get him dual-hatted like Randy was, because we think that's really important. So you're AID administrator and director of foreign assistance. And so you're actually looking at what's a development plan. How do we bring in our private sector arms, like OPIC? How do we bring in the private sector in a new and unique way? China's actually doing much better at this than we are. How do we think about financing and partnership in a different way that's not us bringing money and talent, but bringing a partnership? And that's what the countries want. And if you think for the long term, part of development is a diplomatic thing. Will the countries like us more when they grow so they buy our stuff and give us concessions? That's very real. And it's a fundamental part of development and needs to be, and it's one of the arguments we need to make. But I would go back to, I think you all will be the ones to figure this out, because the structures today and the people in them, while we're trying to think differently, we grew up in a system in a certain way. If you grow up in that system too, and that's the way you think, we're in real trouble. The fact that you asked that question, I think, is exactly right. What needs to be different and how can it be different? It'd take a lot more than this session to go into that. I'm sure we'd all be happy to talk with you more about it, but I think this program that is being created in innovation and development is absolutely right. I would just end by saying the buzzwords today in development are innovation and disruption. I mean, you basically get $5 every time you say it. If you go to the UN meetings, someone says innovation and disruption every 30 seconds. No one has any idea what they're talking about, really. They just use them because they're buzzwords. We go through cycles of buzzwords. But they are the right thing. But we are not the people. The development institutions are not built for innovation and disruption. So we need a different approach. I think we can get there. I think academic institutions have a role, but we fundamentally have to do it differently. And it's kind of a general answer to a very complex question, which a lot of us spend a lot of time on, but you're on the exact point. How is that shift going to happen given the structures that we have?
I'll chime in and talk about maybe a part of the tail end of that process, or what might be the conclusion of the development plan that Mark mentioned. And this might not be the most exciting part of, sort of the crux of the question, but it's something that's absolutely necessary when we think about kind of transitioning out of an environment to geography, or, extricating removing resources. And so in global public health and in other sort of development activity, this has happened in various places historically. So you've got family planning transition that took place in the Caribbean. You've got HIV transitions that's beginning to take place now in Southeast Asia. So if you look at Vietnam and Cambodia, those are countries that are either taking on responsibility for which we are about to transition, or they are about to reach epidemic control for their HIV epidemics. And so it's really about, for us, at the tail end, the sort of what might be the last component of that development plan, having a very clear roadmap for what transition of aid or donor-provided or U.S. government resources might look like in the case of CDC. Second is the conduct of appropriate high-level diplomacy and engagement with the relevant stakeholders. Third is bringing in others, so non-governmental organizations, members of civil society, other stakeholders who have substantial measure in this. That you'd also then sort of move toward establishing interim monitoring programs to make sure the transition is happening, provision of technical kind of consultation along the way, and then finally the clear metrics for what movement out of a place looks like, or what successful transition appears to be.
Hi, my name is Sneha, and I'm a sophomore here. And so I was just wondering, so we talk about diseases like HIV. How can we best invest in orphan and neglected diseases? And do you think that there's an obligation from not only the private sector, but also the government to place a greater emphasis on these types of diseases? Thank you.
You're smiling.
I'm gonna not.
Oh, you're gonna get in trouble?
I'm not gonna.
You'll get in trouble.
Do you want me to talk? Because I won't get in trouble. You know, there's a few initiatives over the years that have put out and tried to tackle a couple of these orphaned or neglected diseases. Some have been more effective than others. To be quite honest, until something with them occurs that is more of a flashpoint, for lack of a better word, I think that you won't see a lot of investment in those areas. You know, the same was true for the Ebola virus disease until we had the very large-scale outbreak. And then all of a sudden, in the span of 18 months, we had 4 different vaccines or so on to try. So until there's a motivating factor that captivates global news cycles, my opinion would be I think it's unlikely to see a lot of investment in that area. That's just my opinion.
So
feel free to disagree over there.
That's probably right, just because, you know, budgets are, there is no room for, you know, $1 billion increases like happened with PEPFAR. It's not going to happen. But then what is it, relative to the great question that was asked before, you know, how would you actually fit that in without a lot of new money? And there's a lot of waste in the systems because we're replicating a lot of things. There actually is resource out there. I would say that the neglected tropical diseases, I hate that term too because they're not particularly neglected anymore. But the solutions to those are not just health. So, you know, a lot of them are poverty related, it's soil related. As economic growth occurs, a lot of them start going down. Malaria, you know, for all our interventions, unless you have economic growth, which is why middle income countries are eliminating, you need sanitation, you need to get rid of water that's around. Economic growth, if done in an equitable way, will help alleviate some of those. But a lot of the services are provided through the education system. And the private sector is deeply engaged. You know, one of the reasons we've gotten investment in neglected tropical diseases is because the FDA gave companies a pass on extending their patent or rapid review of a drug that they want if they invest in neglected tropical diseases or new drugs for neglected tropical diseases. These drugs are not expensive either. Most countries can manage the cost of the neglected tropical diseases, so-called neglected tropical diseases. But it's going to take a different model than the one we have today. And the countries are going to drive it in a fundamentally different way rather than external finance driving it. But I do agree completely that the death rate is so low for most of them. A lot of people are affected, but the death rate is low. And so what's been working more and more is, but it's affecting your kid's ability to be educated, and, you know, really drawing those links across sector. If you just stay within health, it's not going to move. It's by linking it. Nutrition's another one. I mean, being clear that if you have a lot of stunting and kids that aren't fed, they're not going to learn, and then where's your economic growth going to come from? So it gets back to how do we link things in a way that is meaningful for policymakers? Because if you just say there are a lot of people with neglected tropical diseases, like, I know, but I've got all these other things that are killing people, and I'm not going to have the ability and bandwidth to do it. So if you start pulling the sectors together and you start creating the partnerships, I think we can do it. The last thing I would say on this is NCDs is another term that drives me crazy because they actually are communicable. A lot of cancers are communicable. But we call them NCDs anyway. Cardiovascular disease can be communicable. And this, I think, is really exciting relative to what Hank said. And so I think it gives us hope for the future. The reason we can talk about NCDs today is because of the investment in HIV. And I know people think I say that because I'm an HIV person, but it is the first time in the history of development that external finances were used for a chronic disease. So, you know, malaria, tuberculosis is relatively short. Vaccines is often once or twice. It's relatively easy to do that. HIV is a chronic disease. You have to invest in the systems for care and treatment for life and prevention for life, which we often forget about because you're at risk for HIV for 30, 40, 50 years. And so it's a lot like NCDs. And so that system that was built to respond to HIV as a chronic disease is now available and is actually being thought about for universal health coverage in NCDs. And I think that's really exciting. It's not the NTDs, but what's really killing people now is the NCDs. And that investment that was for infectious disease is actually now going to be the foundation for moving forward for NCDs. And some of the African countries, I think, will move faster than others because they had that investment. So it's a really exciting time, and there's a lot of emphasis on NCDs right now. So I think NTDs will come over time, but NCDs are a fascinating field, and the investments of the last 15 years have really made that possible.
I was just going to say, one other thing I'd like to tie into that, because you're getting a bit into the social determinants of health, is kind of like the One Health model that we've been looking at for the past decade or so, where you're tying in our friend from Purdue back there, the agriculture, as well as the environmental health associated with this. So clean water, better agricultural results, more productivity, all that will lessen the likelihood of the transmission of a number of those diseases you were mentioning. Did I take it? I'm sorry.
Yeah, we probably have time for one question.
Hi, I'm a second-year master's student in public affairs here at IU. Firstly, I would like to thank the panelists for their time and for their insightful knowledge. I had a question for Mark. You commented that we should think in a global way, and I do love it, and I think I'll think in a global way. But do you think the institutions and the way definitions are made, it is difficult for us to work in a global way? Because so when you give financial assistance to other countries, it's called financial aid, but when you do it in your own country, it's called cross-subsidization, or you just tax the richer people more. So people, in a way, are okay with helping your people from your own nationalities. There was a study in Germany where people were fine if you were aiding other Germans, but even if a subsidy was given to Greece to bail them out, it was like, oh no, it's not like, they're not our people, so we should. So do you think that definitions and the way our institutions work, it is difficult to think globally, but it is necessary that we think in a global way?
Yeah.
Thank you.
So it's a great question. I'm glad we're wrapping up, because we used to have a rule in the government, which Randy knows, that if you ever speak for more than 10 minutes, you're going to say something stupid, especially if you're answering questions. So, so we're at high risk of that. It's a great question, and this actually gets to when people ask, what are the biggest challenges in global health or development? Or my first question is vision and thinking differently. The on-the-ground stuff, the supply chain, that's always going to be there, and we will solve them over time. But changing your mindset and changing your institutional structure is extremely difficult, and it starts with changing how you think. And if we don't make that shift to thinking globally and drive our institutions to change, we will not solve problems and we will never catch up. So there's no easy answer to that, except we have to do it. And we have to make the case for why we have to do it. And I really think you're the ones to do it. You are going to have to drive policymakers and decision makers, and as you're entering your career, you're just going to have to fight against it. And while it sounds difficult, go back 17 years ago to when PEPFAR was created, the Global Fund was created. Literally, people on the floor of the UN General Assembly were saying, people in Africa cannot possibly do something as complicated as antiretroviral therapy. Let's just do prevention. You can never spend billions of dollars. There was no field of global health. No one would have said 17 years ago that where we are today was possible. So what it took is just a bit of naivete and saying, we're just going to do it. We're just going to push it, and we're going to do it, and we're going to work together, and we're going to accomplish it. And we have. Your challenge is more complicated because that paradigm and who is involved and how the decisions are made is fundamentally different, because the world has actually changed that much in 15 years. But it's also the exciting part, because it's changed so much, you have an opportunity to break into things in a new way. So I don't know how we're going to get there. We're counting on you to get us there. And I mean this deeply. You inspire us. I mean, look at this room. You would never have had more than 3 people in a room 15 years ago if you had a center like this opening. And you are incredibly inspiring. But you will figure this out. Just don't give up. That's the biggest problem. People, you get into the systems, you want to change, you want to be global, you want to think cross-discipline. Then you get into whether it's an academic institution or a development institution, and you have so many walls, and you just say, I'm done, I'm going to go do what the walls tell me to do. Just break through them. And you all have the opportunities to do that because of your connectivity and opportunity in a way. Just don't give up. You will get there. Don't give up. Keep pushing. If you know it's right, you'll get there. So it's a great question, and you're all going to have to figure it out for us.
Okay. I guess I'll just thank our distinguished panelists once again. This is a wonderful conversation, and I have learned so much. Thank you very much.